So this is a really interesting paper that came out last year. It deals with the fact that surgeons using deep brain stimulation of the brain's reward system are now able to modulate mood in a much more precise and powerful way than they can with medication. And so they're having to ask themselves on a regular basis, how much do we crank up the current for this particular patient? How happy do we want this patient to be when he or she leaves the hospital? It's not science fiction, it's a serious question that surgeons ask themselves regularly, and it just raises all these really fascinating questions. So I want to give some background on what it means to stimulate the brain's reward system. People who have been to this channel, my channel, video channel before, have know about rewarding brain stimulation. Briefly, if you stimulate the dopaminergic neurons in the midbrain or the ventral striatum, their main target region in the forebrain, or the medial forebrain bundle that connects the two, it will induce powerful motivation and reward and feelings of pleasure and desire in experimental animals like rats. So if you give a rat the ability to stimulate this region itself with a lever press, say, it will do so until it falls over. Basically, it will stimulate the reward system to the exclusion of food and sex and water and so on. It's a very powerful stimulus. This has been tried in humans back in the 70s and in the 60s even, and before. Some psychiatric patients were implanted with electrodes in the reward system, and one patient who was given the ability to self-stimulate the reward system was described this way. The patient stimulated himself to a point that, both behaviorally and introspectively, he was experiencing an almost overwhelming euphoria and elation and had to be disconnected despite his vigorous protests. But rewarding brain stimulation was discontinued as a treatment option or possibility for psychiatric patients in the, with the advent of effective psychiatric medication, psychopharmacology, because obviously brain surgery is very invasive and quite dangerous. But rewarding brain stimulation is still being used in the lab as a research tool. So one thing you can do is to see what effects different drugs or other procedures, other modulations of the brain have on the brain's ability to process reward. So in this example here, you can see the amount of behavioral response, the number of self-stimulations per minute in relation to the strength or intensity of the current, or the frequency of the current in this case. So in the middle you have the normal response, and then if you treat the animal with amphetamines, you get less intense current is required to elicit the same response. And if you treat the brain with a dopamine antagonist that blocks the dopamine system, so the opposite of amphetamine, then you need a higher intensity current to elicit the same response. You can also use rewarding brain stimulation to drive specific behaviors in experimental animals. So in this picture you see a rat that's running on a treadmill, and whenever it blocks or runs across this little photo beam, the computer will deliver a current to its reward system, and this acts as a motivator, and the rat will continue to run for hours and hours. So deep brain stimulation was introduced as a tool for treating Parkinson's disease and different motor disorders, but recently it's been applied to the reward system again. So we're returning to stimulation of the reward system after a break of 30 years or so. And it's being used to stimulate the reward system because people have found that in psychiatric patients who are suffering from refractory psychiatric illnesses, that means they're not able to be, they're not responding to medication or normal therapy. But surgeons have found that if you stimulate the reward system, or the ventral striatum especially, using deep brain stimulation implants, then these patients will experience some relief. Mood will improve, and their ability to function and deal with their with their illness and with their lives will improve. So there's been a number of studies. These two top studies here are concern depression, so deep brain stimulation of the nucleus accumbens and ventral striatum, which is pretty much the same thing. In patients suffering from depression, with that we see about a 50% response rate after a year or more. And remember that these are patients who were treatment refractory, so medication did not work, and we see a 50% response rate, which is pretty good. That top study also reports that other aspects of cognition, I think it's working memory or something like that, was also improved by the treatment. And the two bottom studies are also concern stimulation of the ventral striatum, but here it's done for patients suffering from OCD, and there we see a 66% response rate after a year or more. So that's 2/3. That's a very high number, and because of that, the DBS of the ventral striatum has been FDA approved in the States and CE approved in Europe, and this Proclaim DBS therapy, for instance, is one of those FDA approved treatments. So it's becoming quite common. On this slide, you can see precisely where the electrodes sit, and yeah. So the paper uses a case vignette of one patient who was given deep brain stimulation of the ventral striatum, and they use this to illustrate what exactly happens when you turn on the current in the reward system, and it gives us an interesting insight into what happens in these treatments. So from 1 to 3 to 4 volts, you can see a steady increase in reported happiness and relaxation, and at the same time you see a decrease in anxiety. And then as you get from 4 to 5 volts, it kind of seems to become too much for the patient. So he's feeling very good, but he's getting anxious that it's just unnatural and too much, and that it might go wrong somehow. And that's completely understandable. But the interesting section here is the area between 3 volts and 4 volts. So you have a moderate happiness, basically, and you have a high level of happiness at 4 volts. So 3 volts, moderate happiness, kind of, and 4 volts, high levels of happiness. And the big question that this paper considers is, do we leave the patient at 3 volts or 4 volts when they leave the hospital? So remember, when these DBS implants are installed, as it were, you have to configure the parameters, the stimulation parameters, to make it work for each individual patient, because the positioning of the electrodes might be slightly different, and the different brains are different, so you have to actually sit there and adjust the current parameters and the voltage so that the patient produces the kind of response, behavioral response, and has the kind of mental state that you want them to have when they leave. But what is that state? I mean, exactly how do surgeons want them to feel, or should surgeons want them to feel or be when they leave? So what is the optimal level of DBS-induced happiness? That's the question that this paper directly addresses. And 5 volts is too high for this patient, but what about 3 or 4 volts? And also, what about healthy individuals? Is this something that could ever become common the way, say, plastic surgery has become common? So let's consider the first question. They write, an intermediate voltage stimulation of 3 volts was agreed upon, leaving the patient relatively happy. After extensive yet difficult deliberation about the benefits of an only intermediate stage of happiness and an intermediate voltage, the parameter settings were left unchanged. So they decided that 3 volts was better than 4 volts for this particular patient. He came back and wanted to perhaps go up to 4 volts and have the electrode set at 4 volts, but they kind of talked him out of it. The way these implants work is that the current is kind of left on at a certain voltage. Once you've agreed, or once you've found a good working stimulation parameter setting and a good voltage, then you leave it on like that permanently. So it's different from the conditional rewarding brain stimulation that I've made other videos about. So let's look at their arguments for keeping this patient at 3 volts rather than 4 volts. So moderate happiness rather than high levels of happiness. They have 2 main arguments. One we could call the argument for motivation. So they point out rightly that there are many things in life, not just happiness, but we also want people to succeed in their relationships and seek out a high level of education and engage politically and with volunteer work and so on. And they question whether a high level of happiness is actually conducive to these other aspects of what we might call well-being more broadly. They cite one study in particular that seems to show that a very high level of happiness is actually not conducive to seeking out high levels of education or getting a high income, but actually rather more moderate levels of happiness are associated with a higher income and a higher education. That same study also found that for relationships and voluntary work, the high level of kind of baseline reported happiness is better. So this is a study that looks at healthy individuals, not patients. And it's not clear whether the findings of that study translate or how they translate into this 3 volts versus 4 volts issue. The other argument is the argument from adaptation. So they write, being locked into constant happiness seems dysfunctional as it inhibits flexible adaptation to the highly variable context in which humans are expected to act. So this is just pointing out that if the deep brain stimulation kind of keeps patients artificially fixed at a certain point of happiness and unable to kind of experience lows and highs in response to different situations in life, that's obviously going to be dysfunctional for everything or for many things at least. And but the question is whether deep brain stimulation really induces such a reduction in variability. It's not clear from their studies, and it is the kind of thing that they could have looked at. So they could ask patients who are receiving DBS to the reward system whether they are experiencing a reduced variability in their mood. So those really are the arguments for staying at 3 volts rather than 4 volts. You want to leave the patient with the desire to seek out more things in life and not kind of be content and just not behave in that way. And also you don't want their mood to kind of become fixed at a high level. It's not clear to me, and I don't think it's entirely clear to the authors, that 3.5 volts or 3.7 volts might not be better even for things like education and income. this is going to take a lot of research to work out. Anyway, they then move on to asking the question, what about healthy individuals? So they write, enhancing one's cognitive states is not intrinsically wrong, but can be discouraged, however, based on extrinsic reasons, such as lack of proven efficacy, safety concerns, or compromising of a person's decisional competencies. So the question here is whether, like plastic surgery, deeper stimulation to the reward system might eventually be sought out by healthy individuals who want to just improve their mood somewhat. Say that a person is not clinically depressed, but is generally sad or anxious or frustrated, and he or she would wants to kind of feel better overall. What do we say about that? What if, deep brain stimulation becomes as safe as, say, plastic surgery? What do we say to healthy individuals who want to undergo this kind of surgery? And so they have these three objections or concerns. One is the lack of proved efficacy. So first of all, obviously these kind of surgeries and treatments have not been used for healthy individuals. So we don't really know what kind of effect they would have. But assuming that it would work, then we get back to the question that they had for the patients that are receiving this kind of treatment, namely, what level of happiness is most conducive to the various aspects of life that we care about. So we have a range of real world tasks and personal real life goals that people are expected to attempt in life, and if they can instead go and stimulate their reward system, might they kind of say, never mind all that, I'm happy the way I am, I'm not going to make any efforts to change and improve. That obviously would be a bad thing. On the other hand, you could argue that there are people who might do more with themselves and with their lives if they felt a bit better and less anxious and frustrated. But they acknowledge this. They say future studies would need to show that an improvement in mood scores indeed translates into an improvement in real-world tasks and an achievement of personal real-life goals. It's hard to see how such studies would happen, but again, you have the comparison with the patients, so you can go and look at the patients and see and compare patients, because I mean there's going to be hospitals and surgeons that do go to 4 volts, and you'll be able to see that reflected on these various tests of anxiety and happiness and so on, and so you'll be able to compare the patients who got the 4 volt treatment compared to the 3 volt treatment patient group and see which one had the better outcome in terms of these other life goals or tasks like their relationships and their education and income and so on. And that you could argue that would translate also to patients, healthy individuals who would seek to improve their mood somewhat. So the second argument for prohibiting enhancement use, so the use of deep brain stimulation to the reward system in healthy individuals, is safety. They write risk of harm in DBS, such as bleeding, infection, social misadjustment, or psychosocial changes. All of these are reasons why extremely few healthy individuals would expose themselves to deep brain stimulation, and it would need to be safer, and it would need to be very clear what the effects are before, such as in plastic surgery, you could see healthy individuals going through with this kind of surgery. And that's just that's a time thing, really. I think I don't. I think this kind of surgery is becoming safer, and you're seeing a reduction in the incidence of bleeding and infection and so on. Um, but it is brain surgery, and it's a lot harder than, say, plastic surgery or dental surgery or eye surgery, all of which are surgeries that healthy individuals can go through at a private clinic if they want to. Will we ever see private brain surgery clinics? I think so, but I have no real way of saying when or what kind of improvements would need to take place before that could happen. So the third argument against this kind of enhancement use of DBS is the compromising of a person's decisional competencies. So they write, the patient might ask for different DBS parameter settings than the treating physicians, reject lower voltages or DBS interruption, and engage in other reward-seeking behaviors. So this we saw this with the patient case vignette patient that they described earlier. He wanted to be at 4 volts, and the surgeon said, well, you should be at 3 volts. And this obviously would happen with healthy individuals as well. We saw with the rats that if given the ability to self-stimulate, they became completely dysfunctional. They stopped eating, they stopped drinking, and so on. I find this very interesting, the fact that there is no way that anyone could be given access to their own reward system directly. No one would be able to handle having the ability to kind of turn up the current as much as they wanted in their reward system. It would ruin anyone. There's no way that that would ever be an option. So if this kind of treatment were to ever become available to a broader public, then we'd need to decide on maximal or optimal stimulation parameters before you even start the treatment. And the patient could never have access to changing those stimulation parameters themselves, because it would be catastrophic. But there is precedence for that. I mean, in clinical settings, there are protocols for how to manage painkiller medication, for instance. So to summarize, deep brain stimulation of the ventral striatum is an invasive but very powerful modulator of happiness and mood, and raises all kinds of interesting questions for surgeons and for anyone who's interested in where this is going. The meaning of optimal happiness is unclear and requires a lot of further research and thinking. In particular, the effect of varying levels of happiness on different types of performance or different life goals. Again, the relationships and the education and so on. We just don't know. Maybe we do know. Maybe I just haven't read the right papers, but I don't know that it's clear what kind of temperament or baseline level of happiness is best. I just don't know. But obviously a lot of people are at a level of happiness that's way too low. They're way too sad or way too anxious, and not just the clinically depressed people, probably. I assume there is at least equally large number of people who are not clinically depressed, but who self-medicate through alcohol or cigarettes or other behaviors, and whose lives might be improved if their happiness was a little higher, if their reward system was a bit more active. I'm not sure, but I kind of suspect that's right. I suspect that's right. But we won't know until there is some significant safety improvements um, associated with this kind of surgery. The comparison I come back to is with plastic surgery. At what point do the risks of plastic surgery become tolerable to lawmakers? What kind of demand is required from the public or from different individuals who are not hospitalized, but who still seek the help of private surgeons? At what point does it become morally and legally feasible to perform deeper stimulation of the ventral striatum in a healthy or a person who's not clinically depressed, but depressed? That's the big question. And when, if and when that happens, what kind of voltage do we apply? And that question, again, is being asked by surgeons who do deep brain stimulation of the ventral striatum in the hospital in clinical patients every day. Where do they want the patients to be mentally in terms of their happiness and their mood when they leave? Any thoughts? Let me know.